My name is Lisa Walker. I'm a registered nurse and a certified registered nurse infusion, which is my specialty. I'm going to talk to you today about Krystexxa. Krystexxa is a medication used to treat gout. Gout that is not responsive to oral medications such as Uloric or allopurinol. Now, gout is the buildup of uric acid crystals in the joints. It can be of the hands. The feet are the most common ones to be seen first, but it can be anywhere, any joint, the hips, the knees. And it's because when the uric acid level gets too high, the uric acid comes together, forms a crystal, and you will see these large bumps. These bumps are called tophi, and they are very painful. Okay? Before you can be treated with Krystexxa, we will do a blood test called G6PD. You need to have this because we need to know if you can process the Krystexxa. But most people, it's fine. So with Krystexxa, what we do is you're going to get this infusion every 2 weeks. It's given over 2 hours. What I'd like patients to know is when you first start Krystexxa, you need to have, your doctor will give you medications such as colchicine or some steroids, because when we give the medication, it rapidly causes the uric acid level in the blood to drop. What this does it allows the uric acid crystals in the joints to start dissolving and coming back into the blood to be processed and eliminated. That will cause what we call a flare. You will get pain in the joints that have these crystals. We know this. I warn patients about this. I don't want somebody stopping therapy because of this. It does go away. When you're on this treatment, you will repeat your uric acid blood level 2 to 3 days before every scheduled infusion. That's because we're looking to make sure the level is staying low. Now, sometimes I'll see somebody's uric acid level rise. It can be one of two things. The more concerning is that they're developing antibodies to the Krystexxa. I haven't seen that happen too often. Normally when I see somebody's uric acid level rise, it's because it was a holiday weekend or there was a family barbecue and they weren't as careful about the diet as they normally are. I have seen this medication take somebody's uric acid level from 11, which is very high, to dropping it to 2.3, and then after the second dose, less than 0.01, which is barely measurable. The exciting news about this is it's now been approved by the FDA that it can be given with methotrexate. It's another medication used in the rheumatology and immunology world. It's also used in the cancer treatment, but can be used with Krystexxa now to help prevent and ward off the development of antibodies. Developing antibodies would cause us to have to stop using the Krystexxa treatment because the risk of a severe allergic reaction would be too high. Now, the studies have found when we give methotrexate in addition to the Krystexxa, there's a significantly lower risk of having any allergic reaction to the medication, and there is a significant improvement in the response to the medication. I have seen a patient, for example, who is a professional carpenter, whose hands he could not use anymore because of all the tophi. That's the buildup of those crystals in his joints. And over a period of 3 to 4 to 5 months of being on this treatment, he was able to go back into his shop and back to woodworking. It's a really good medication. Don't be afraid of the side effects you read about. It works very, very well. And that's Krystexxa for gout. Okay, I'll just lay it in. When we give Krystexxa with the methotrexate, bloop.
Sorry, it wouldn't go away. It's like when you're not trying, that's when it moves.
Now it's done, it's over.